Hello everyone. Today we'll be looking at the different junctions in the oral cavity and we'll be relating it to health and disease. And I'm your presenter for today, Dr. Sayyid Jafar Abbas Zaidi. Hello everyone. So I'm Dr. Sayyid Jafar Zaidi and I'm an assistant professor in the Department of Oral Biology at Dover Dental College. So the learning objectives of this session is that by the end of this session, students will be able to relate the different junctions in the oral cavity, compare and contrast the different junctions in the oral cavity, and relate these junctions with respect to health and disease. So let's start off with introduction of this topic. So there are three junctions that are present in the oral mucosa. So the first junction is the mucocutaneous junction, which is represented by the lip, the outer part of the lip and the inner part of the lip. Then we have the mucogingival junction, and lastly we have the dentogingival junction. So this is an histological example of a mucocutaneous junction. Uh, from let's just look at it from the outer perspective and from the So this is the outer side of the lip that you can see here, and from this is the inner side. So the outer side of the lip is different from the inner side of the lip. And how is it different? It is different, the reason being it is more keratinized, while the inner side of the lip is not keratinized. So we have a stratified squamous epithelium on the outer side, and on the inner side, the epithelium lacks keratinization. So this is the features are that there's a transition between the oral mucosa and the skin, and this transition can be actually seen in the outer side of the lip and the inner side of the lip. So in the outer side there are few sebaceous glands that secrete sebum, and while on the inner side there are no sebaceous glands. Okay, and the epithelium is quite thin on the inner side as compared to the outer side, and there are many capillary loops that bring blood close to the surface. That is why the vermilion border and the vermilion zone, that is why the lip, it appears to be more reddish in color because of the thin epithelium, and there are many multiple blood vessels that are very near to the epithelium. So next we'll be looking at the mucogingival junction, and this mucogingival junction is where the alveolar mucosa meets the attached gingiva. So this is the area where we have the mucogingival junction. So what are the features that are typical of this area? As you can see here, the attached gingiva is quite pale in color, and while the alveolar mucosa, uh, not only is it stretchable and elastic, but it is more reddish in color, and it is the attached gingiva is keratinized, and this is the reason why it is pale in color. Besides, stippling of gingiva is seen in the attached gingiva, while there is no stippling seen in the alveolar mucosa. Furthermore, if we just look at the different layers, the attached gingiva doesn't have any submucosa, while the alveolar mucosa has a submucosa, and within the submucosa there are salivary glands and there are elastic fibers there, and that is why it can be stretched. So here are the different features. So the alveolar mucosa is thicker, it has elastic fibers, it has a thick mucosa, while the attached gingiva is firmly attached to the periosteum. That is why it is known as the mucoperiosteum. And the color change is evident there. Now, this is another example of the attached gingiva. So, although this is considered to be, this part is attached gingiva, but above it, where it encircles the teeth, we have the free gingiva or the free gingival groove. Okay, so mucogingival junction is the junction between the attached gingiva and the alveolar mucosa. So we have discussed so far the mucocutaneous junction that is represented by the outer side of the lip and the inner side of the lip. Then we looked at the mucogingival junction that was shown by the junction between the attached gingiva and the alveolar mucosa. Now, finally, we have the dentogingival junction. Now, this is the junction where the free gingival groove actually attaches or encircles the tooth. So, uh, so we have an outer part of the attached gingiva and we have the inner part of the attached gingiva. So the inner part actually has two more parts. So we have the attached gingiva on the outer side. So, and from this area, we have the free gingival groove, and the free gingival groove, we have the junctional epithelium and the sulcular epithelium. So this is the sulcular epithelium that I'm encircling, and at last, where the epithelium actually meets the tooth is known as the junctional epithelium. And a part of the junctional epithelium is the epithelial attachment, uh, through which the uh, epithelium actually attaches to the tooth. So because of this attachment, the junctional epithelium and the sulcular epithelium, there's a gap in between the tooth and the gum, and this gap is known as the gingival sulcus, and it is of usually around 0.5 to 3 millimeters in depth. And this is actually measured by a specific instrument which is known as a periodontal probe. So a periodontal probe actually measures these, and the the length of this actually determines health and disease. So how does it do that? So up to 3 millimeters is considered to be normal. If it is beyond 3 millimeters and if it bleeds upon probing, then it is considered to be diseased or inflamed. And uh, whenever the depth of the gingival sulcus or the periodontal probe exceeds 3 millimeter, it is known as a periodontal pocket. And in this instance, we call it pocketing. So this is another example of the dental-gingival junction. So some more features of dental-gingival junction is that it actually seals the tooth and the underlying tissues, and it actually has a little bit of inflammatory exudate and some polymorphonuclear leukocytes, which are permanent inhabitants of this place. So, but with age, it actually moves towards the cementum side. But within this gingival cervicular space or the gingival sulcus, there is gingival cervicular fluid. Now, what exactly is inside these gingival cervicular fluid is that there's fluid that passes in between the epithelial cells. They are discriminated epithelial cells, and plus there's inflammatory exudate that attaches to this liquid which is inside the gingival crevice. So and uh, so it actually helps us to identify uh, if there is a lot of inflammation, then there will be more of this gingival cervicular fluid. So this is the area where the gingival cervicular fluid is usually present. So we have the attached gingiva which is keratinized, while the free gingiva is not keratinized, whether it's from the outside, whether it's from the inside. So some more features of the junctional epithelium. So junctional epithelium is the epithelium that is present on the inner side of the gingival crevice, which is shown here. It is stratified, squamous epithelium. It is not keratinized and surrounds the tooth like a collar. And it is confluent with the attachment epithelium. So what exactly is the attachment epithelium? The attachment epithelium is the area where there is actual tooth contact between the epithelium and the tooth, and this attachment takes place through hemidesmosomes. So finally, we look at some unique features of our tongue. So our tongue, not only is it embryologically and histologically different in terms of its anterior and posterior parts, but its sensory and its taste also has different innervations. So this is the anterior part of the tongue, and this is the posterior part. So the anterior two-thirds of the tongue has its sensory innervation from the lingual branch of the trigeminal nerve, and this is the general sensation, while the sensation of taste is carried by the choriotympanic branch of the facial nerve, which is the seventh cranial nerve. So, and the posterior one third, the sensory and taste uh, innervation is carried through the glossopharyngeal nerve, which is the ninth nerve. While the motor part of both the anterior and posterior, it is supplied by the hypoglossal nerve, which is the 11th cranial nerve, except for the palatoglossal muscle and the pharyngeal branch of the pharyngeal branch. Those are actually innervated by the vagus nerve. So the blood supply is to the lingual artery, and which is the tonsillar branch of the facial artery, while the veins of the tongue, they drain in the internal jugular vein. The lymph drainage of the tongue is through the submental lymph nodes of the anterior two-thirds, and the posterior two-third lymph from the posterior two-thirds of the tongue drains into the submandibular and the deep cervical lymph nodes. So, so lastly, uh, in order to just sum up, we have different types of junctions that have different specific functions. We discussed three basic types of junctions in this session. The first being the mucocutaneous junction, and the example I gave was of the outer side of the lip and the inner side of the lip. Then we have the mucogingival junction, that is a junction between the alveolar mucosa and the attached gingiva. And lastly, we discussed the junctional epithelium and the dentogingival junction, and we talked about the normal depth of the gingival crevice. It's being from 0.5 millimeters to 3 millimeters in depth, and if the depth is more, then it is considered to be inflamed or diseased, and that is why periodontal probing is performed in order to find out whether the gingival crevice and the gums are healthy or not. So it is very important to discern a healthy oral mucosa from the diseased one, and this is the prime responsibility of a dentist or the treating oral physician. And knowledge of different junctions of the oral cavity will help us in this identification. So that is all for now. If you have any questions, please feel free to email me at jafar.zedi@dohs.edu.uk. Thank you for listening. Bye bye.